So for those exercises, it's also important to make sure the hip or the pelvis is staying neutral, not falling into that posterior pelvic tilt. And then for another treatment option, the knee may be lacking range of motion for that left side if the quads are tight. So teaching some of the quad stretches where just even the basic ones the patient can do at home. And then here making sure the hip or the pelvis isn't anteriorly rotated and stays neutral during that. So that's one. Or the one sitting down and then having the patient bring their butt to the knees, just depending on where the patient's at for flexibility and comfort and pain and overall body control, because obviously standing requires that patient to also work their abs and kind of a whole body thing. So just depending on the patient for how to stretch the quads. So for my second deviation, I chose backward trunk lean at load response, which I'll demonstrate here. Okay, so for the backward lean, before I describe the hip movement, I wanted to explain why people will backward lean upon heel strike and loading response. So I drew another little diagram. The pink side would be typical gait upon heel contact. The purple demonstrates the backward lean. And then the green is the GRF, the ground reaction force that is caused from the different patterns. So for typical heel contact, the GRF, as the body is moving forward, the GRF force is braking and going up through to the center of mass, which as you can see is behind the knee and the ankle joint and in front of the hip joint, which is a big difference between these two movements. So the GRF force wants to create a plantar flexion torque, a knee flexion torque, and a hip flexion torque. So during typical movement, the glutes as hip extensors will go against this hip flexion torque to prevent the trunk and upper body from flexing forward or preventing that hip flexion torque. So if the glutes didn't do this, it would cause what you explained in your lecture as jackknifing. So for people with weak hip extensors, they do this backwards lean so that the GRF force, instead of landing in front of the hip joint, will land behind the hip joint. So it still creates a plantar flexion and knee flexion torque, except a larger torque for both of those because it's farther away, but also now creates a hip extensor torque, or it probably even goes a little closer to the hip joint. So, and that's caused because the backward lean moves the center of mass of the body backwards. So since the GRF is behind and it's creating an extension torque, the hip extensors are no longer needed to counteract a flexion force. So they're using the weight of the trunk up here to counteract the excessive forward momentum that exists on heel contact for braking motion. So overall prevents jackknifing. So hip movement through the backward lean upon initial contact and loading response. I have pink as normal gait pattern and then purple as the deviation pattern for hip movement. Flexion is on the top, extension is on the bottom. So as you can see, typically when the hip is flexed during initial contact and stance phase, I have it more towards neutral. I did include some hip flexion at the start, as that would return to neutral not through glute activation as much, but more as just the body translating forward and diminishing that as more of a passive result. So also bringing up the diagram again, the backward lean diminishes the normal flexion at the hip as the pelvis is also brought back too. So that's more of a 180 no hip flexion right there. And then it still dips down into extension. Like I said before, more from the body translating forward as the left extremity is going on heel contact and making it step forward. So that's still bringing the right extremity into extension through the hip. And then up here, flexion occurs. I edited it a little bit. I added a little bit more flexion through the swing phase because there is still flexion seen, but it's much less than typical. Honestly, it could even be brought up more depending on how much salinas and how much flexion occurs at the hip. But also just from my drawing, the hip flexion brought up through the step is still not as much as it would be through a normal trunk stance because the trunk is leaning back so much more. And the trunk is still leaning during this part of the gait cycle because the left extremity is doing heel contact loading response, so that trunk lean is maintained throughout the entire gait cycle as both extremities are moving. And that's assuming that this is trunk lean due to lack of glute strength versus like lurching or anything like that. So treatment options for the backward lean upon initial and loading response would be primarily strengthening glutes, which can be done, I drew this out and I'll also demonstrate later, can be done starting in prone with the knee bent, really focusing on bringing just the glutes up, and by lying in prone that'll kind of eliminate all other parts of trunk stabilization to just focus on this glute activation as the main hip extensor. And then you can progress to the patient standing, maybe even having a band pulling into flexion as the patient brings the hip into extension. So standing will bring in the factors of making it more of a functional movement as the patient would be standing during normal gait pattern. And then strengthening like lower back extensors and everything and would also help as preventing jackknifing and helping with gait movement. So that can be done through like bird dog as a good beginning movement, or even bird dog with just the lower extremities. So, or another treatment option would be stretching hip flexors if that's tight, and then working on preventing that posterior tilt that the patient might fall into. And I forgot to explain ways or methods to stretch hip flexors. So if the hip flexors are tight, obviously having the patient supine and then the PT extending the hip, depending on how tight the hip flexors are, is a method, or educating the patient on lying on a better flat surface, having their tight hip flexor lower extremity hang off the surface and then having that stretch it as well, or doing, the typical flexion of the hip or stretch of the hip flexors right here is another method too.